this video, I want to talk through some of the three-dimensional anatomy of the lower leg. So a lot of times with the lower leg compartments, I think it's useful to think about the lower leg as a cross-section or a slice. So I'm going to draw this cross-section and kind of talk through it. Feel free to draw along with me. I think that's the best way to learn it. So you can pause the video and just kind of go at your own pace. So here I'm going to draw the outline of a cross-section of the lower leg. This is going to be kind of the middle third of the leg, and this is going to be a left leg. So just to orient, this is going to be the medial side, and this is going to be the lateral side. So as I'm looking down at the lower leg, first thing I want to do is I want to orient, as I'm doing this cross-section, to the bony anatomy. So if we think about the medial side of the leg, we're going to be looking at the tibia, and this is kind of that tibial ridge. So the tibia is going to come right here. I think about it as roughly a triangular bone with that kind of shelf. And then the fibula is going to sit posterior to the tibia. So I'm going to draw this interosseous membrane that's going to connect the two. And again, I'll draw the fibula as kind of a triangular shaped bone, the shaft cross section. So tibia, fibula. The other thing I want to draw in are these other membranes between the muscle compartments so that we can break the lower leg into our three compartments. So the anterior compartment is going to be here, separated from the posterior compartment by the interosseous membrane. But then also we're going to have a membrane between the anterior compartment and the lateral compartment, and the lateral compartment and the posterior compartment. So these are going to be my three compartments, muscle compartments, and I think it's helpful to organize muscles in this fashion. So then as we go through and we start to draw in the muscles, let's start with the anterior compartment. And I think about the muscles in almost a triangle shapes. So you're going to have three triangles or three main muscle groups here, and the first one is going to be your anterior tibialis. So just along the anterolateral shin of that tibia, this big beefy anterior tibialis is going to come through. So it's a broad part on the front, and then it's going to taper back towards the tibia in that triangle pattern, and that's going to allow me to draw in these complementary triangles here of the other two muscles in that anterior compartment. So if this is my anterior tibialis muscle, the other two muscles that I'm going to have, if you think about looking down towards your toes, the one on the medial side is going to go towards the big toe. So that's going to be my extensor hallucis longus. And then this is going to go towards my other toes. So this is going to be my extensor digitorum longus. And that's going to be my anterior compartment, those muscles. If we move into the lateral compartment, these are going to be along the fibula, so fibularis muscles. I like to call them peroneals, but you can think about them as fibularis muscles. And this lateral compartment I think of as kind of like, instead of triangle shapes, I think of as like moon shapes. And we're going to go with the two main peroneals, which are going to be the longus and brevis. So I'm going to draw in my moon shape here. So there, and then here. And the outer muscle, the bigger muscle, is going to be my peroneus longus. And then deep to that is going to be my peroneus brevis. So that's the lateral compartment, pretty easy. The posterior compartment I think of as three layers, almost like shelves. So I'm going to draw in the shelves, and this obviously is not perfect, but is a nice way to learn and represent these. So pardon my artistic shortcomings here as I draw. But if you think about these shelves, then we can start thinking about superficial to deep. What are those muscle layers? What are those groups of the posterior compartment? So if I draw in, I'm going to draw in these kind of muscle bulk, muscle bellies here, and this outer, most superficial layer are going to be my gastrocnemius. So medial gastroc, head here, and lateral gastroc. Deep to that is going to be my soleus muscle, and then deep to that are going to be my deep posterior compartment muscles. Again, I like to think about these as almost triangle orientation. And the posterior tibialis is going to be kind of like the anterior tibialis, in which case I'm going to draw that triangle first, and it's going to snug up next to the posterior border of the tibia, and it's going to kind of taper just like this. And then my other two muscles in that deep posterior compartment, so this is my post-tib, are going to be kind of here and here, right up. Whoop, I gotta sneak a little bit into that soleus so that I'm a little bit on the posterior of the fibula here. That's a little bit more accurate. Okay, so posterior tibialis. And remember, in this posterior compartment, that this is going to be a little bit counterintuitive to where these muscles run, as far as if they're going to the big toe or the extensors, or sorry, the flexors for the other 4 digits. So if you remember through the tarsal tunnel, those tendons cross of the flexor hallucis longus and the flexor digitorum longus. So this orientation is going to be different from the anterior compartment. My flexor hallucis longus is actually going to be on the side that's away from the big toe. So my flexor hallucis is going to be closer to the fibula, and then my flexor digitorum longus is going to be posterior tibia. Okay, so my hope is that this gives you a good representation for the anatomy of the lower leg. There's going to be a second video as we discuss some of the then dry needling trajectories to try to target these specific muscles. But let me do this just as we're thinking about maybe if you're dry needling these muscles, or even just trying to get a sense for where they are anatomically. You really want to know where the neurovascular structures are too. And so I'm not going to talk about all of them, but the main 2 that we're going to focus on are going to be one in this posterior compartment, and that's going to be almost at, I think about, again, this triangle of the posterior tibialis. At the apex of that triangle, that's going to be one of our neurovascular bundles, and then at the kind of base of the triangle. And so these 2 are going to be, as you see, again, this is my interosseous membrane separating anterior from posterior compartment. So this front neurovascular bundle, that's going to be where my deep peroneal nerve runs in the anterior compartment. So deep peroneal. And that nerve is going to run with the anterior tibial artery and vein. And then posteriorly, this neurovascular bundle is going to be my tibial nerve, and I'm going to want to avoid these if I'm needling. These are my precautions. And that tibial nerve is going to run with the posterior tibial artery and vein. Okay, so hopefully that drawing gives you a sense of that 3D anatomy, and we're going to come back in part 2 and discuss needle trajectory.